Welcome to another deep dive, where we try to make revision, well, a bit quicker and easier.
That's the plan.
Today, we're tackling boxer's fracture. It's a really common hand injury. You see it quite a bit.
Absolutely.
So our aim is to give you, the listener, a solid framework for it, maybe some memory tricks along the way, just to help you nail this topic.
Exactly. We'll pull out the really key stuff about boxer's fractures, make it efficient to understand, and importantly, recall.
Perfect. Okay, so let's start with the basics. What exactly is a boxer's fracture?
Okay, so put simply, it's a break in the neck of the fifth metacarpal bone.
Right, the fifth metacarpal, that's the long bone in the hand going to the little finger.
Precisely. And the neck is that bit just below the knuckle joint. You might sometimes hear it called a Brawler's fracture, too.
Ah, okay. Brawler's fracture makes sense.
Yeah, and it typically happens from, well, punching something with a clenched fist, a direct blow.
Got it. So what's the mechanism there? How does that punch cause the break?
Well, the cause is usually that direct impact, as I said, on the closed fist. Think maybe someone punching a wall or another person in a fight.
Right.
But it can also happen in sports, or even just accidentally hitting something hard. The force travels straight down that fifth metacarpal.
Okay. And are there certain people more likely to get this? Any risk factors we should know about?
Yeah. Obviously, people involved in physical fights or contact sports are at higher risk.
Makes sense.
Also, things like having had hand fractures before or maybe having weaker bones for some reason could make someone more susceptible. Perhaps even really forceful, repetitive hand movements, though that's maybe less common.
Okay. Let's picture what's actually happening inside the hand, the pathophysiology.
So the break, it's almost always at the neck of that fifth metacarpal. It's just structurally a bit of a weaker point there.
Right.
The fracture itself is often transverse, so straight across or maybe oblique at an angle. And importantly, the broken bits of bone often get displaced, sort of shifted.
Ah, so they don't line up properly anymore.
Exactly. And you can also get damage to the soft tissues around it, like ligaments or tendons.
Okay. Now, if someone comes in with hand pain after, say, punching something, what else might be going on? What are the differentials?
Good question. You need to consider other breaks, maybe in the other metacarpals or perhaps the phalanges, the finger bones.
Sure.
Could also just be a bad bruise or direct trauma without a fracture, maybe a stress fracture if it's from overuse, rather than a single blow. And you think about tendon or ligament sprains, possibly even a dislocation nearby.
Right. Need to rule those out. How common is this specific fracture, the epidemiology?
Well, finding precise UK-wide numbers is tricky, but anecdotally, it's definitely common. We see it a lot in A&E and fracture clinics.
And presumably linked to those causes we mentioned?
Yeah, definitely associated with fights, contact sports, but really it can affect all sorts of age groups, both men and women.
So what should you look for? What are the classic signs and symptoms? The clinical presentation?
Typically, the patient will complain of pain, there'll be swelling, and often you can actually see a deformity like a bump or an odd angle at the base of the little finger, around that knuckle.
All right.
It'll be tender if you touch it. They'll likely find it hard to move their fingers properly, especially the little finger, and their grip will probably feel weak.
And making a fist would be difficult.
Very difficult, yeah. Usually quite painful.
Okay. So you suspect it. How do you confirm it?
Yeah.
Investigations.
The main investigation, the go-to, is definitely an X-ray of the hand.
Right. Standard procedure.
Exactly.
Yeah.
That will show the fracture line nice and clearly, and crucially, how much displacement there is, if any.
And anything else?
Very occasionally, if it's a really complex break, or if we're worried the joint itself is involved, a CT scan might give more detail, but usually X-ray is enough.
All right. And treatment. How do we manage a boxer's fracture?
The main goal is just to keep it still so it can heal. Immobilization.
So splint or a cast?
Yep, usually a gutter splint or a cast is applied. If the bones are quite badly angled or displaced, we might need to perform what's called a closed reduction.
Which is?
Gently pushing the bones back into a better alignment without needing to cut the skin. Surgery is actually pretty rare for these.
Ah, okay. Good to know.
And then, of course, managing the pain, and later on, physiotherapy or exercises to get the movement and strength back.
And what's the recovery usually like? The prognosis?
Generally, it's pretty good. Most of these heal up well within about, say, 4 to 8 weeks.
That's not too bad.
No. And with decent rehab afterwards, people usually get back to normal hand function. Of course, how severe the break was initially, if there were other injuries, and importantly, how well the patient follows the treatment plan, all that can affect the final outcome.
Right. Compliance is key. Are there any potential pitfalls, complications?
Yes, there can be. Things like the bone healing in the wrong position. That's called malunion, which won't leave a deformity or effect function. Or, less commonly, it might not heal at all. That's non-union. You can also get stiffness in the finger joints or some lasting weakness in grip.
And associated injuries.
Yeah, if tendons, ligaments, or even nerves were damaged at the same time, that can complicate things. But getting proper treatment really minimizes these risks.
Good. Okay, let's try and cement this. Any memory tips? Maybe an example question.
Okay, a simple mnemonic could be pinky punch problem. Helps link the common cause, the punch, with the location, the pinky finger side
The
metacarpal.
kinky punch problem. I like it.
And a quick question, MSRA style. A young man presents after punching a wall. He has pain and swelling over the knuckle of his little finger and can't make a full fist. An X-ray would most likely show a fracture of which bone?
That would be the fifth metacarpal neck.
Exactly, neck of the fifth metacarpal.
Brilliant. So, key takeaway. Boxer's fracture means that fifth metacarpal neck, usually from punching something.
That's the essence of it. Common injury, usually straightforward management, good outlook.
Great stuff. And if you want to dive deeper into this or other MSRA topics, remember to check out PassTheMSRA.com and also FreeMSRA.com for loads of resources. Definitely worth a look. Finally, just a thought to leave you with. Given how vital our hands are for everyday life, maybe we should think more about the long-term impact of these seemingly minor hand injuries and perhaps how better to prevent them in the first place. Something to ponder. Thanks for tuning in to The Deep Dive.